Hi, I am a 48-year female and I suffer from a chronic pain illness, complex regional pain syndrome. I'd like to talk to you about a few things on spirituality and weight, how I believe I have found meaning, and the meaning has helped me cope, and how I believe those two things have affected my treatment. First, I'd like to talk about my spirituality, and I will try to be brief. I'm a little nervous, so I hope that I come across in a manner that will be productive. I do think that in the beginning my faith was shaken and that I had been a little angry, but by the time I was bedridden and had nothing but time and time alone to dig deep within to find my core beliefs and help look for ways to cope with my pain due to the fact that I was unable to take pain medication. I found positive affirmations a very good outlet for me. And another thing, I believe it's called bridging. I'm not real sure at the moment. And I have a lot of friends that were into things like that, and I personally didn't think much about them until I was in this position. The longer that I was in the bed, the more clear it became to me that the spiritual part was a very important aspect in order for me to be able to cope with the things that were coming my way. So, that being said, I think I may have even covered both the meaning and the coping at this point. I would like to go to how I believe that has affected my treatment. I believe when I go into a doctor for the treatment that has been advised to me to help me deal with or reduce my pain, I come in with a positive outlook and being willing to do almost anything to make it better for myself, which makes it also more, I believe, gratifying for the people that struggle to help people like me to find themselves and to be able to survive living with something that is constant and ongoing. From my point of view, I just would like to say that I believe when doctors first meet you and try to evaluate you, that I think the time frame from the illness should really be considered on how they approach the individual in what they're dealing with in the chronic pain field, especially. I think it takes a little over a year before you can actually truly believe that it has happened to you and that it is going to continue. So, I'd like to move on to the weight issue. I think that myself, I'm pretty confident and outgoing, and my weight truly has not been an issue for me in many ways in my life because I am confident and self-assured, and people generally don't really notice my weight. Even at my heaviest, people thought I weighed probably 60 pounds less than I did. However, I was on a quest to lose the weight when I fell, and I had done a great deal of work, and I had lost about 70 pounds. After I fell, I gained back 35 pounds, which was very discouraging and disappointing. But I had to find meaning in that. And the only way for me to do that is to believe that this made me realize that you have to continue on a day-to-day basis to work on the things that inhibit you from having as full a life as you can with any kind of chronic pain or long-term illness. I think that coping with my weight and realizing that when I couldn't get around, that I had to really change my diet and my thinking about food and why I was eating and what I was eating and how it affected my life. Once I found the meaning in those things, I do think that my treating myself better and taking better care of myself and eating more properly, it did ultimately help my pain and my ability to cope with my pain. Uh, Being on a schedule makes a huge difference, I believe. So, how I think that my treatment was affected by my weight, I think that it is a big factor in how people perceive you on uh, on first appearance. Maybe not everyone. I certainly don't. I don't really look at people in that manner, and I think that's part of the reason that most people don't see me in that way. So I hope that what I've said has been helpful, but I would like to say that you would consider these things while you are helping people try to deal with something that is horrific at best, uh, in the worst of the worst times. But I will say it has brought me more peace in my heart and in my mind than I've had throughout my life. I thank you for listening, and I hope that this helps in some way, and I am thankful for the chance to pass my thoughts along.